Our next presentation is a team effort because they worked on that together, so I will introduce them together. Travis Howlette and Jalea Tucker, and the topic that they will address us on is the impact of a team-based group medical visit program on anxiety, depression, and the quality of life for overweight and obese patients.
Good afternoon. So my name is Travis Howlette, and I will be presenting along with Jalea Tucker. And really just to give you a reason why we co-presented on this is that with the 6 weeks, we did have limitations on what each one of us could do individually. And I took on the aspect of this program, of the Healthy Weight and Wellness program in Rochester, New York, that we both had our projects on to kind of work with the implementation and all the setups and resources needed to conduct the program. And she'll go into kind of the actual program. She was there for the rollout and the like. So to give you a quick understanding of this program, it was the Healthy Weight and Wellness program at the Anthony L. Jordan Health Center in Rochester, New York. And the concept was to find patients referred by their physicians or clinicians that had at least had a greater than or equal to 25 BMI, as well as 1 to 2 weight-related chronic conditions or symptoms. That includes hypertension, diabetes, trouble breathing, etc. So what we were able to do, and my role when I first got there, was to look at ways to kind of provide these resources of this screener. We had a pre-screener where the physicians and the clinicians would look at and conduct to see if they have the BMI, the proper criteria, including the weight-related chronic conditions. And then we also had a pre-survey that I had put together as part of my program that kind of captured GAD-7 and PHQ-9, which she'll get into a little bit with her project, but as well as some factors of eating styles and healthy living factors. So that was the gist of it. And on top of that, because it was a group medical visit structure, and that's the nature of this program, limited amount of time is provided for that visit. We need to figure a way to kind of make sure everything moved at a pace to allow the time for the consultation with the physician, as well as for the actual group program. So we actually developed an EMR template to be able to use, as well as like making billing easier. That was a whole discussion, and I'm sure that some of the clinicians know a little bit about that. And what we saw was that even in that, there was just still some things that we could have improved, so that's in my recommendations if you go over to the poster. As far as enrollment, we had active enrollment. I was used, especially after the first few weeks of enrollment of just having the providers kind of refer their patients. They didn't get as much referrals as they would like in the first few weeks, so they were looking at ways to better utilize my time there. And it ended up me just going to the clinics and actively getting told by the physicians and clinicians who were working that these patients look eligible, please go in and do the screeners and do the surveys. And there was a lot of benefits from doing that. It also gave me one-on-one time with the patient for my own personal development, but also to increase the motivation to come for that visit. As you can imagine, there's a lot of barriers to even attending a visit like that. So with that said, I'm going to leave the rest of the time for her to kind of go into the program, Jalea. So yeah.
So as Travis said, the structure of the program is really a group medical visit model, and really the idea around that is that there's significant literature that says that a lot of people, and especially in underserved populations, have some sort of mental health issues, especially within the obese population. So especially for me, I did a little more research, and the idea was like, well, is it really the mental health that's impacting their obesity, or is it the obesity that's impacting their mental health? And one of the key parts of this program is the fact that we use a multidisciplinary team. So there's a physician, nurse practitioner, social worker, psychiatric nurse practitioner, registered dietitian, and then Travis and myself. So the idea is that we really wanted to provide a holistic method for treating obesity within the group medical visit. Some of the key factors that I thought, as Travis said, we as a part of the screener, patients were given the GAD-7 screener for anxiety as well as the PHQ-9 for depression. The way that's set up is that if you score less than 10, the idea is that you have 0 to mild, either anxiety or depression, and anything 10 or above on this screener, you're scoring moderate to severe. So I specifically looked at the people who scored above 10, and the average for the group that we had for the group medical visit that scored above 10, they were at about a 15, so a 15.14, so at about a moderately severe for depression and about a 12.76, so about moderate for anxiety. just within the 6 weeks that we had the program, we were able to impact the way in which they screened for both anxiety and depression by dropping one whole clinical category. So for people who scored above 10 initially, the average score for depression dropped to about an 8, so about a mild level of depression. And for people who scored above a 10 for anxiety, dropped to a 7. So they also dropped to mild anxiety as well. So I think that that's pretty significant considering that the program had only been for 6 weeks. And for the people who had scored in the much higher range were actually able to drop a clinical category. Something for me that I personally, or more specifically, did with the program was I was able to talk to each patient that was in the program each week. So I called each patient and I was able to troubleshoot with them and say, these were the goals that you set up for last week. How are you doing with those goals? If they weren't able to achieve the goals, I literally sat for as long as it took and I said, let's figure out a way for you to be able to achieve those goals. And one example I wanted to give was one lady who had said that she had really had a hard time increasing her exercise. That's something she wanted to increase. And so I asked her the type of things that she liked to do in her house, and she says, well, I like to talk on the phone. And we had actually previously we had given them pedometers and said, try to achieve your 10,000 steps a day. And I said, well, if you're on the phone, just walk around your house. I'm pretty sure if you speak on the phone 3 to 5 hours, you might reach that 10,000 every single day. So that's really kind of the gist of what my part of the project was really being a part of that holistic plan of care for everybody in the group medical visit, adding to that multidisciplinary team, and it really seemed to have a significant impact, at least by the numbers that we have based on the screens that we get. Thank you very much.